Okay, so good afternoon, everyone, or again. And so as we approach the end of the conference, it is my great pleasure to introduce our last keynote speaker, Professor Vera Araújo Soares, who I am sure many of you already know. And she's a distinguished academic, currently serving as the head of the Division of Prevention at the Center of Preventive Medicine and Digital Health at the Medical Faculty of Mannheim in Heidelberg University. And Vera has a remarkable career that spans across many different countries in Europe, including Portugal, Scotland, England, Netherlands, and Germany. And she has dedicated her research to developing and evaluating evidence-based interventions aiming at promoting health behaviors and preventing chronic diseases. And her work is deeply rooted on the understanding of contextual factors that shape health and how they interact in a complex system. She held very prestigious roles, including the position as the 14th president of the European Health Psychology Society, and she currently serves as the regional vice president of the Psychology Coalition at the United Nations, reflecting her commitment to translating theory and empirical evidence into impactful practice, and if I'm still allowed to say, real world change. And for those that did not know, Vera is Portuguese, and she was one of the first Portuguese academics to specialize in behavioral science and being a pioneer to the work that we are trying to bring now as well here to with Be Change Research Center. So it is really, really very special to us to have you here today. And today Vera will share her insights on the topic of a system issue, interdependence for health. So please join me in welcoming Vera Araújo Soares.
Well, thank you so much. I always ask, why did I say yes? But, it was Robert and Susan, and how can you say no? That's the best question, actually. And so, as you can see, even for the tiles or azulejos that I have on my first slide, I am really Portuguese and proud to be Portuguese and very happy to be here with you today. And so I am bringing to you this issue from the perspective of a user, because really I'm not a system scientist, I'm a behavioral scientist. I was trained as a clinical health psychology. I worked as a clinician and as a researcher for many years before I left Portugal. So, but I'm bringing you this issue through the lenses of a user. And this is the outline for the presentation today. So I wrote this outline first, and then I concluded I need to write a chapter on this or a book or whatever. And then I tried to put what I had written, which was 2 pages, into an outline. And then I concluded I don't have enough time. And then I kept cutting and cutting, and this is what came up. I'm sorry for that. It's not as I envisioned it. Utopia, often we chase utopia, and this morning Lucy and Joe have talked about this, but we not often find it. And so I'm going to talk initially about the wicked problems that are part of our daily lives as human beings in this world. And then I'm going to talk about why systems are important for health and why we should consider this. And then I'm going to talk a little bit about the research gaps that are currently identified as they link with this climate emergency that we all live in, and looking into the tools that behavioral science has that can be used for this. And then I'm going to talk about a little bit about accelerating implementation and working for generalization, departing from the presupposition that if we have to start again from scratch in terms of trying to develop interventions to change human behaviors, to increase mitigation and adaptation behaviors at the level of the individual, communities, and other higher level systems, we won't be on time. So to be on time, we need to potentially generate forms of generalizing knowledge that we have developed within the area of health to other parts, to other behaviors. And so that's it. And then I'm going to talk a little bit of conclusions on your role too. And so there's something that we are all tremendously aware of. Of course, we are here in Lisbon. It is springtime, and the weather has been very unpredictable. In the past, it used to be different, but now it changed. And we know that the health of our planet has a huge impact on the health of the populations. And this schematic representation here, or this drawing here that you see very badly there, a little bit better there. It's a very interesting schematic representation of the impact of climate change on our lives and our livelihoods. And you can see here that it will be an infinite continuum of catastrophes and droughts and conflict and migration and food insecurity. So there's a lot here. So the health of the planet is intertwined with the health of our populations, with our health, with the health of the crops that we eat. And not only air pollution is bad for us, but it's also bad for our climate. And people don't like to hear this. And so what I usually say is that if we want to talk about this to people, we should start about how do we want the future to look like? Let's stop talking about how bad it's going to be. Let's talk about how do we want it to look like? And I think behavioral science has a lot to offer there. So, but this is just, I'm not going to dwell on this, just to a list of things, events that are supposed to be 1 in 100-year events occurring time and time again in several parts of the planet as the caps in the polars melt away. Flooding Europe in 2021, catastrophic floodings in the same day, in the same year. Next year in Europe, droughts. And next year, well, you can see here a lot of floods all over Europe. And now again in Greece, as you heard about it. And so, and in Portugal last year, and this was very close to my birth date. And I have seen fire just behind the garden of my brother, and I was there fighting it. And it's very, very scary. And I have cousins of mine who are fire women, not firemen. And so I've been there. And in these days, you can see from this observatory that lists all the occurrences of fires. In one single day, we had 55 fires and 172 either in resolution or being resolved. So it's huge. And then the next day it started decreasing. And when you look into the sun and you take a picture, this is what you find. You can hardly see the sun. So the scale of the issue is very big. And of course, this is going to bring more difficulties for us to manage a huge complex system as our planet with many different societies. All and each one of them needs some food security in order to thrive, in order to develop. And we also need our healthcare systems to support people with many other problems that are going to emerge and are already emerging in the majority world. Thank you so much, Lucy and Joe again. So this is quite important because at the moment, if we look at the pledges that different countries have made, even looking at the pledges, we are not very well in terms of decreasing or not advancing so fast the increase in temperatures in the planet. And if we look into policies and the policies in action, we're also going to be staying either 2.5 or 2.9 degrees. But this is being optimistic, probably. So really, the scale of the issue is so big that it's now calculated that children born in 2020 will experience a 2 to 7-fold increase in extreme events. And they're going to experience this, and particularly when we compare these children with those who were born in the 1960s. So there are a lot of health and social inequalities. as health researchers, we are acutely aware that there are huge social and health inequalities that shape people's lives and that, quite frankly, are hard to battle with our health psychology interventions, with our behavioral interventions. And these inequalities are shaped by many things, as we know. And if you can see here, the fact of the matter is that the majority of the emissions, of the carbon emissions, are made by those of us, but 10% of those of us. And we are part of it, actually. We are the 10% more wealthy humans in this planet. We are privileged and we emit a lot. And if you compare this to the bottom percentage, the poorest 50% of the population emits very little, just 10%. So the current world indeed is not fair, but I cannot find my cursor, and that doesn't matter. Oh, I found it now. Thank you. And we also can see from this graph here that there is a lot in terms of critical emissions. And again, you can see here, traveling, particularly air travel, is the one that contributes more to these emissions. And so we need to think about what are we going to do. New forms of transport, potentially using e-bikes and so on and so forth can help, of course, and be more cautious in the way we travel. And this is what I've done. I've traveled here by bus and train. And then we are dealing with many different threats. And these threats are threats that are that can be linked to several issues related to climate change. And I've tried to list as many as I could think for climate change, as you can see there. So we have food and water insecurity, you have catastrophic weather events, you have power outages that can lead to, hospitals stopping to work, machines that are caring for people stopping to work. It has to do with many different emergencies that can occur. We have also migration, conflicts and war, but we also have other national and international threats that I started thinking more of late of the past elections in some country or others. So, but other national, international threats also include wars and conflicts, but they also include air and water pollution, scarcity or the perception of it, cybersecurity or the lack thereof, mis and disinformation, artificial intelligence, and the sixth industrial revolution. And so we need to have both system, that's what I'm going to contend in my first step. We need to have both system and individual preparedness ready so that we can increase resilience to be able to deal with all that's coming and all that is already there. If you think about infectious diseases and pandemics, and if we are thinking about vaccination and health practices, we can do many things that I've listed here, some things that I listed here. We can also do many things that are targeting the individual, that are targeting the infrastructures, they are targeting the different public health infrastructures, but we also need to have global coordination. Otherwise, the weakest link will be the weakest link for humanity, of course, particularly if you think about Ebola and what's been happening with USAID funding, for instance. And of course, utopia. Thank you very much for the topic. Indeed, the UN Sustainable Development Goals that have been crafted some years ago, the idea would be to reach all these Sustainable Development Goals by the year 2030. I fear that this is not going to happen, but it's good to have ambitions and it's good to have an aim and a goal. And it's good to work towards that. And although we believe that currently at the pace that we probably are not going to reach it, it's good to have ambitions and to keep it. It might not be 2030, it might be 2035, it might be 2040. We are working towards this, and all of us here are working towards this. These are the Sustainable Development Goals, and you can see here SDG 3, which is good health and well-being. So this is the one that all of us work towards, but actually, if you look into it, we work towards many of this. And oftentimes research that we do target different of these goals. Education, women's rights, many of the things that we do, water security, many of the things that we do target different goals, not only SDG 3. And so why are systems important for health? And what is a system? And so, as I said to you, I'm not a system scientist. So I'm not going to be here hoity-toity saying this is what it is and you should do it like that. I'm a user. I'm a person who uses these concepts. And so you can see here that one of the key characteristics of understanding a system is understanding there are several interconnections between different layers and different parts of the system, and that the whole is bigger than the individual parts alone. And so it's quite important to understand that this interconnectedness gives rise to different emergent properties and characteristics, and that we need to understand this. And when we are developing interventions, we need to understand that sometimes something we think is the cause is not the cause. Because actually, if we understand and we sit with people or we conduct a thorough analysis, we understand that actually women are not taking aspirin because although somebody told them to take it because they have preeclampsia, in the pharmacy they were told, actually, you can't do it because you're pregnant. It says here in the aspirin medication. So there's many things within a system that constrain our actions and that make people do things that actually for them make sense. But for us in the healthcare professions, looking from the outside, seems like this is illogic. Why aren't they taking the medication that I told them to take? So systems are quite important. And then I brought here something that I think it's also very, very interesting, because this is something that I've been mostly of late being exposed to with colleagues of mine that work in the majority world, or low and middle income countries as they are often known, which is that often social and structural conditions cause clustering of health needs. And you can see here from this image that syndemic theory says to us that the context where people have their shared environments, their shared social environments, have an impact on the way they interact with the different parts of the system and the way that they prioritize or not their health. They may be forced to prioritize other things. And this is also associated with the risks and diseases that cluster around places and cluster around people and communities. And of course, oftentimes these risks interact and they lead to different medical conditions, can be metabolic, cardiovascular, cancer. There's a lot happening there. And there are syndemics already identified in different parts of the world that are quite typical. These are situations, diseases, conditions that are understood to emerge usually together. And if you look at Germany, for instance, one of the things that seems to emerge together is, as you can see here, obesity, diabetes, colon cancer, hypertension, depression, and COVID-19. This was a study conducted during the COVID-19 pandemic. So all of these things seem to be emerging together. And the same thing you could see for Asia, where malnutrition, intimate partner violence, chronic diarrhea, and COPD. In Africa, we have diabetes, tuberculosis, HIV, and depression. And also in the Americans, in this case in Brazil, drug use, alcohol consumption, violence, and STIs. So there are a set of diseases that come together. So we need to develop complex interventions and understand how the system and the context influences individual behaviors. And we need to stop being judgmental and blaming people for their condition. We have to understand their condition. And when I say we, it's not we, because all of us are not. I'm talking about the general the general population. But yes, and so aside from our human systems where we are all integrated, we also have the Earth system. And this Earth system in this Goldilocks planet that we live in is is an amazing chance, a haphazard chance that we got to evolve in this planet that caters to all our needs. And at the moment, the way we are engaging with our planet and the way we are altering the atmosphere is leading to a potential for a hothouse planet, where balance will be lost, homeostasis will be lost, and the chance for a good life that we are used to might change. But of course, if we do some things, and here we have the impact of the individuals and the impact of individuals acting within a system, we can do something. And I do believe that behavioral science can do a lot on this. And I feel today that I'm doing a summary of everything that I've seen during this conference today, yesterday and today. There was a lot of people talking about and presenting their work on sustainability, talking about recycling, talking about microplastics, talking about cycling to and from work and from school. And so I feel like I'm just doing a little bit of a summary of capturing everything that was said and bringing it in the final presentation. So I'm sorry, you'll soon go and eat something. And of course, our planet has also boundaries. And there's a very, if you see this green one, this is the safe operating boundary for our planet. And the ones where we are in the yellow and in the red means that we have overcome the safe operating space for our planet. And so this is even outdated already. There's a new one, and it's a bit worse. But, I still believe we can do it. And this is, again, a call out to Angel Chatter. She's there. This is something that Angel led some years ago within Public Health England and an organization that Angel at the time was leading. And this was trying to understand, the complexity of human societies and the complexity of human life. And this idea that we have different layers, the individual, but then we have the family, then we have the neighborhood, the community. It's like a Dahl, Green, and Whitehead model meets psychology and public health and behavioral science. And we try to, when we're drawing this together, we were trying to come up with what are the sciences that can potentially have an impact on supporting change? And we came up with anthropology, sociology, political science, psychology, medicine, biology. There's a lot of sciences involved here. So the idea is that whatever it is that we do it better first when we are together, when we're working in a team, and second, when we are transdisciplinary working. So it's not just interdisciplinary, but also transdisciplinary, because we have to get out of our disciplines and talk to the people with lived experiences. So in this, a shout out to Susan and Robert. This was something we wrote some years ago in response to a paper that was published in The Lancet by colleague of ours, Martin White, and others saying, oh, everything that we fund now needs to just be upstream interventions. Nothing funding, no funding should go to work with individuals. And we said, yeah, interesting, but, and the but is quite clearly that population and health inequalities are best conceptualized in a complex systems. We agree with it, and that's what I've been saying. And I get very offended when I say, well, actually, by background, I'm a psychologist, and they say, oh, you know nothing, you just work with people. You don't understand that the system is an impact. Actually, I had a year of sociology, and actually, I do care about the context, and I was taught context matters, very much so, and we have to take it into account. So I agree that health inequalities and population health are better understood and conceptualized in the complex systems model with interdependent elements, but we also have to think that all these systems are packed with people. people in different levels of the hierarchy, some with more managerial positions, but actually some of them have a say on how things go and what are we going to do. And we need to work with these people to understand where they are, to meet them where they are. I cannot believe that everybody that works for a company that produces oil is evil. I cannot believe that they don't think about their family. You know, I might be naive. I never spoke to one of them, but, well, actually, I've known one and he was really nice. And he died already, unfortunately, with a heart attack. So I don't think both things are connected, though. So he was really lovely man. So I do believe that people are people and we need to meet them where they are. And I do, of course, we understand that in interaction, humans behave quite differently, that they behave individually. But I still believe, and we have all of us proof of this because we have worked with healthcare professionals, we have worked with commissioners of care, we have worked with practice and policy partners, and with all of them, we have managed to come differently, you know, and conquer something different, a new vision, a new narrative, a new way forward. And so yeah, that's one of my contentions for today. The third point, research gaps in tools in behavioral science. So first, in terms of research gaps, if we look here to this IPCC report, they try to come up with all the impacts that climate change is having on health, but also on adaptation and vulnerability. They have really different working groups, and different working group reports detail different things. I once registered myself to review the report, and it was after I read it that every time I saw a tree, I started saying, "Oh, I love you so much. I hope you don't go." So it was funny, but a bit tragic at the time. But I think it spurred me to think clearly about what I want for the future of my children, my children's children. And when I say my children, I say the children of my friends, the children of the people I don't know. I don't care. And I think about the children of the horses, of the bears, of the deers, of the bees. I don't care. The planet doesn't belong just to us. So, and then when I first arrived in the Netherlands, I was asked to be part of this group of people that conducted. This was the now, but it's the Dutch Science and Arts Royal Commission, and they commissioned us to look into planetary health and to try to understand what is planetary health, and what do we know about this, and how do we know if this is impacting human health, and how can we shape the system in order to have further research funds to increase our knowledge and support the development of further interventions that can keep us within a stable system. And so what we have done, we've compiled a long list because the topic was, what are the research gaps? How is this climate crisis impact the health of the populations? And so we compiled a draft list, a very long list of gaps, by looking into several things that had been published until then. So the Whitney et al. Paper had been published by the Lancet Rockefeller Commission, other papers that have been the 2030 Agenda for Sustainable Goals. So we went over all of these things and we compiled all the things that academics and researchers and practitioners were saying. What do we need to know in order to be prepared? You know, because we need to be prepared. We are scientists. We have to prepare because, you know, that's how we do it. And so from this very long list, we had 120 experts, 150 experts coming and looking into this list, and looking into this list and saying, I agree, I don't agree, this is true, this is not true, you're missing this. I would put them into this position, this is the most important, then the second most important, the third most important. And based on this, we then compiled a list of urgent research questions that need to be to be looked into. And I'm very happy, very happy to see that actually there is already a lot of research being done in this area. And so as you can see here, you see this thing here. So we have issues about the long-term effects and the long-term impact of microplastics on the human. I didn't specify it here, but if you go to the report, you have all the details. But one of them is the long-term impact of microplastics in human health, for instance. How is this going to impact the kidney and kidney stones? I have no idea. Nobody knows. We need to look into this. What is the impact of this climate changes, for instance, on the nutrition and food security and insecurity of the populations? How is it going to change the composition of different cereals? We already know that some cereals are decreasing their content of protein. Is this going to continue? Is this going to affect other cereals? This was a study done with rice, for instance. And so there's a big list. And so many things all of us here are already doing. And I was quite happy to be here at this conference and learn about this. And so the second part of this point 3 is something that you already know. So I'm not going to spend much time on this. And for me, this is the treasure trove of behavioral science. So we have several behavior change techniques. And in this review, I reviewed the key contemporary approaches for intervention development, and I summarized them. And in the center, I put the stakeholders and the context around it. And the idea is that we have 6 key steps. And actually, everywhere we go, even when you think about the COMBI, TDF, behavior change wheel, and the intervention development that is done through this, always the same types of topics and are covered by most of the frameworks. And they all say this is an iterative process and you need to have the context and the stakeholders at heart if you want to make sure that your intervention is sustainable across time and actually implemented, apologies, in the real world. And so, and this is something that I also like very much, because this is, I'm becoming Susan now, but in terms of something else, which is in terms of interventions. There are so many thousands of interventions. It's unbelievable, you know, and there's so many thousands of apps. We keep on reinventing the wheel time and time and time again. And I am sure, could it be my daughter? Oh, it's here. I'm sorry. Every time she arrives home from school, she calls me. I knew I should have disconnected. Yeah, it's her. I told her not to call me. It's on airplane mode now. So this is embarrassing. So you see, I have another colleague doing the presentation with me. It's my daughter. So, I like this very much because this is a paper that was published in 2021, came more or less alongside the new renewed MRC framework for the development of complex interventions. And what it says to us is that, you know, we really need to scrutinize the environment and see what is available. I'm not saying we're going to pick something off the shelf, developed in a very affluent neighborhood in the United States, used in a very expensive school that has their own swimming pool, their own tennis courts and all the rest of it, and use it in Portugal or in Germany, where we don't have school. Well, surely in Germany, we don't have schools like that. And so I'm not saying that, but what I'm saying is that if we have evidence, and currently we have a lot of systematic reviews that tell us what are the best things that are there, could we potentially pick those up and try to analyze what are using the BCIEO, what are the mechanisms of action, what are the behavior change techniques, and then engage with members of the public to try, and stakeholders to try to adapt this to our reality, to our context, and try to do it in a way that we embed it in existing infrastructures. because it's much better than creating new infrastructures, isn't it? It's too much work, and yeah, it only complicates things. So that's why I like this, because it just tells us to do this. You know, don't try to reinvent the wheel time and time again. Look at what is done. And so being here yesterday and today, I've learned about so many relevant interventions, and I'm just hoping, crossing my fingers, that somebody has a compilation one day of all of these things and an analysis and a clear analysis. And I hope BCIEO will help in the future. Machine learning, computers. And of course, many people spoke about this, ways of engaging stakeholders. And of course, these ones here are things that I have done myself, and that's why I put them here. These are things that I've done, but there's much more. And these are things, a shout out to Gerd Crombé, if he's there. These are things that I wrote in a chapter that we published in the Comprehensive Clinical Psychology book. And this chapter was about intervention development for health behavior change, integrating evidence and perspectives of users and stakeholders, because this is quite important. And so what we try to do in this chapter is to list the different ways you can engage with stakeholders. But there's many more ways. These are the ways that we knew. You know, now where I am in Heidelberg University, there's a lot of talk about communes, so community networks. So there's a lot of work being done and community networks. So there's other ways of engaging with stakeholders. And of course, we have the BCIO. So I was just listing really the tools that we have and the TIPME, you know, the typology for interventions in proximal physical microenvironments that has 18 different possibilities of things that you can do and how can you change the environment, the proximal environments in order to support people to eat healthier or stop smoking or, you know. So there's a lot that we have. And we also have, and again, a shout out to Susan, something that she contributed to develop, and Fabiana Lorencato too, which is guidelines on how to write policy briefs to engage with our politicians. This is quite important also. How can we share the information that we create in our scientific fields to make sure that it reaches the right person at the right time that is in charge of making, hopefully, the right decision for the health of the populations. So these are all the tools we have, and I've already spoken about this, and you can read it at your leisure. I'm just trying to be as fast as I can, and so this is linked to what I said in the beginning, which is something that worries me, which is if we have to do for mitigation and adaptation behaviors and system changes, if we have to do the same grueling type of intervention development efforts that we have done so far, I don't think we are going to be ready on time with interventions, with measures to support, you know, changes that are going to be coming at a faster pace. So in my view, we need to learn from that's my passionate view, actually. We need to learn from the majority world, because they're already dealing with this. They're dealing with food scarcity. They are dealing with droughts. They are dealing with crop failure. They are dealing with insecurity at several levels. And so, and also at the same time, we have had this decades-old experience of developing interventions to change health systems, to change individual behaviors for health. So how can we pick this up and learn from this to then generalize this, the data that we gather there, to other types of behaviors, particularly co-beneficial behaviors, which means behaviors that are both important and relevant for nature and from the planetary perspective, and for the populations. For instance, like eating a little bit less meat. I'm not telling anybody to stop eating meat, but a little bit less. And so yes, but now, because I had 2 studies to present here that took up 30 slides, and because, you know, my time is limited, and this is not a degree course that I'm delivering here, it's just It's just a simple keynote. I decided to present instead to you 2 studies that we have conducted that targeted different parts. They didn't target necessarily the individual, but target other layers of the system. And then in the end, I'm going to introduce to you briefly the other 2 studies, very, very briefly, just 1 slide each. It will be just the title. I am sorry for that. You will have to wait for the results to come and for another conference for me to present it. So, so yes, this is one study that we've conducted, and this was the Baby Clear study, where we did a complex healthcare intervention to increase smoking cessation during pregnancy. And this happened because in the northeast of England, we had a big percentage of women smoking during pregnancy. And actually, this study was started in 2011, where we initially did try to understand why is it that midwives are not implementing national guidelines for stop smoking during pregnancy. And so we conducted a theoretical domain framework, not interview, but questionnaire. We developed a questionnaire. We used it with 700 and I don't remember 19, that comes to my mind, but it's published. Don't hold it against me if the value is, the number is wrong. 700 and something midwives trying to understand what are the barriers and facilitators that lead them not to implement these guidelines in their clinical practice. And we came up with several barriers and facilitators. The key barrier was they didn't know how to refer to this issue with the women. They didn't know what to ask, you know? And of course, asking somebody, do you smoke? If you're pregnant, it might be seen as a bit offensive. And midwives in the UK are the ones who see pregnant women, didn't want to damage their relationship to the pregnant woman, because this is a relationship they establish across the whole of pregnancy. And so they didn't know how to introduce this topic first. The other thing, they didn't have a carbon monoxide monitor with them. So even if somebody would tell them, well, of course I don't smoke, they didn't know if they were saying the truth or not, regardless. And so what part of the intervention was actually providing every midwife a carbon monoxide monitor. Part of the intervention is actually training every single midwives in 17 different hospitals to actually introduce this issue and to say, this is actually something we do with everybody and make it part of the pathway of care. Everybody who comes will do this. And actually, this is something we did then with Fresh. Aha, there you are. And so this is something we did at Fresh. At the time was Martin that was working with us. And so this is very interesting, because we did this big survey. We brought the data back. We organized a full-day workshop where we brought from each hospital the team, the gynecological and obstetricians, as well as the midwives together. We shared individualized by hospital data to each unit, and we say, you see your own data and you discuss your own things. And we asked them to set goals for what they wanted to do, you know, and how did they wanted to go ahead and produce change. And then we picked up all of this. Oh, sorry, was that me? And then we picked up all of this, and we and then we shared it with a company, because there were too many hospitals for us to go to as a university and to train everybody and to give further training, because people move hospitals and they drop and they go working somewhere else. So we had a company coming, and we shared with them our results. We helped them to develop their intervention, and then we tested their intervention. We tested the intervention in a step wedge evaluation. And so that was quite interesting. And we had NHS trusts, and we had data on 37,726 singleton deliveries. And the results were very good. The referral rates increased 2.5 times. The quit rates doubled. after the introduction of this intervention. And better than anything else is this. The quitters babies were 6% heavier, which is 210 grams. It might not seem very much for us, but for a baby, it's a lot, and it's very important, and it's very much associated with health outcomes. So this is one study where we intervene at the level of the pathways of care. You can read about the intervention. It involved referral. You can read about the intervention. It's published. And then this is another intervention that we've done, which was very interesting. This is the foodscape, transforming the foodscape. This was School of Public Health research funding that we got. And so in the northeast of England, we started realizing that we have a high density of fast food operators. And in some streets where streets that are very, very deprived, we have fast food operators side by side. And so, and we did a lot of work as secret shoppers, going to different fish and chip shops and buying fish and chips and taking them to the lab and saying, how much calories do we have here? And we had fish and chips that provided 1,600 calories, you know? And we know that 26% of people in the UK eat out at least 29% of their meals are out of home. And some people even don't have cutlery or how to cook at home. And so this is complicated. And we also did studies with the salt shakers where we proved that, you know, if we have salt shakers with 5 holes versus 18 holes, that is a big difference there. And then we engaged with a supplier, which was Henry Kolbeck. I still remember them. And we engaged with them in developing a small packaging to provide the fish and chips, because what we found before was that fish and chips was sometimes provided in paper, in the newspaper, in different packagings, different sizes, and all of them were very big and provided a lot of calories. And so we joined efforts with Henry Kolbeck, and we created this small snack bite, which we call the light bite. And we've managed to engage with them and then engage with the people who bought the packages from them to start using them. And of course, we did a pilot and we wanted to do an RCT, but we didn't, of course, because they run away with it. So we started the study, I think probably in 2017. And by 2019, they had already sold more than 1 million packages. So we couldn't do the study, but we're happy. They had a small package that was already in the world somewhere being used by people. So, and this was the newspaper, actually. This was the real newspaper coverage in the yellow press, bashing the research team, you know, and saying, you know, God help us, you know. And this reminds us, of course, that the implementation of evidence based prevention measures is also a matter of public debate, you know. And so they just now do-gooders are cutting our fish and chips. How dare them? Of course, the package was smaller, but you also paid less. Not so much less. That's why the fish and chip operators like that. Together we can do it. And here I just call your attention. So with this, I'm just giving you some, and I know you know this. This is just a summary. Sorry, this is just a summary. I use too much my hands. I promise I'm not Italian, but I love Italian and Italians and Italy. So I could be, who knows, maybe in a different life. But this is a study that just came out end of March. And this is a very interesting study that was put out and conducted by colleagues in the World Health Organization, as well as colleagues also in the UK, actually, and in Milan, in Italy. You see, that's why I was gesticulating so much. And so this study talks about easy wins. And for all of us who have contacts and interactions with policymakers, if we want to give some easy wins, and the reason they call them easy wins is because in a small amount of time, you can have a big change. And so the fears that often prevent politicians from acting, which are related to the fact that I want to be reelected again, either in 4 years or 5 years, can be just cast away, because these are things that you can have easy wins with. So this was published in the Lancet, Public Health or European Health, I don't remember anymore, but you will have the link here. So, and I'm going to share this with you. And so there are easy wins for tobacco, for eating behaviors, for all sorts of things at different levels. Some of them targeting the individual, some of them targeting the system. So I just put it here so that, you know about this and you can use it. So these were the studies that I wanted to present here, because this is something that I've been working on. What are the similarities in determinants of health and climate mitigation behavior? And we did a repertory grid study where we created different triads of behavior, some health behaviors, co-beneficial behaviors, and just climate action behaviors. And we ask behavioral experts to tell us, what do you think are the determinants of these? And so we analyzed the data, but it was just, this one was 30 slides. So I concluded I wouldn't present it, but we're going to be publishing it soon, and then you can see it. And this other, but I will say something about this in the conclusion, so don't worry about this. And this one was trying to look into how have so far interventions that are targeting behavior change, focusing on climate mitigation, behaviors and health, with health co-benefits, how are they being developed? Are they taking into account evidence base? Are they taking into account intervention development frameworks? Are they engaging with the people? Or are they just, as usual, it seemed like a good idea at the time, is Lagiat. So Martin Eccles, sorry, Martin Eccles is not here, but I'm sure he's somewhere taking beautiful pictures. So he's a fantastic artist, actually. So the take-home message on accelerating generalization that I have here for you, and for now I need my glasses after my 3rd time coronavirus from conferences, my husband brought me the virus. I just discovered last week that I can't see so well, very close, and I bought a 20 euros glasses. Seems good. So yes, so the take-home messages on generalization. So current knowledge on intervention development is often not used when developing interventions targeting mitigation behaviors. So we need to start using it. Understanding of mechanisms of action in these interventions is often absent, is not spelled out. It can be, it can be implied, but is not spelled out. Experts seem to believe that knowledge created to understand health behavior change can also help us with developing interventions targeting climate and climate mitigation and adaptation. A framework on boundary conditions for knowledge generalization should potentially be developed, or do we have already too many frameworks? I don't know. And then we need to start accumulating, refining, and adapting off-the-shelf interventions with user and stakeholder engagement, and stop reinventing the wheel. That's my personal note. My final slides, I'm sorry, I'm almost done. So this is about your, our, my role. So this is a paper that I've published with Esther Papis. It could have read behavioral science. It doesn't need to read health psychology. But the idea is that we won't have health if our planet is not healthy, because the planet provides the background where all of us live and survive. And so we, as health psychologists and as behavioral scientists, being very interested in the health and the health of the populations, we need to make sure that we integrate this knowledge in things that we do. And things that we do are research, teaching. We also work within our own organizations. Even if we don't work in other organizations, we also work in our own. So for instance, when I was president of the European Health Psychology Society, we started collecting from every person that came to our conference and submitted an abstract, what are you doing in terms of the Sustainable Development Goal? And how does your research that you're submitting to present at our conference links to Sustainable Development Goals? 1, 2, 3, 4, 5. You can select more than one. Select as many as describe your science. And so we in everywhere that we work and with everybody that we engage with, we can, if we want to, have an influence. So why not using it for good if all the others are using it for the opposite? So organizational transformations are possible, policy advocacy, and even, of course, also in our private life. I'm sorry, with this, I can't see you. I see this, but I don't see you. And so yes, so in this paper, we have listed many different things that people can do at these different levels. In terms of research, you can see here many suggestions. And we can do all of this as linked to the health and the health of the populations, because everything that we do is linked to our planet and to the health. And, you know, we have more and more, for instance, now we're doing a lot of research on heat and heat action plans in Germany, and how heat is having a detrimental impact on even cardiovascular diseases and other types of conditions. So, and also teaching. And I give you an example of what's happening in our medical faculty. In our medical faculty currently, we have developed, and it's now being it started last year, 2024, being implemented in the medical faculty. This is medical faculty training medical students, of course. And we are integrating planetary health content into the primary care module. But the idea is to integrate it across the whole of the training of this medical doctors. And the idea, we're also training on climate-sensitive health counseling involving simulated patients. And as I said, in the future, we want to do it across the board. And so there are many interesting books, there are many interesting podcasts, but the final say for me, and I'll forget about this, I'll go to just the final, is that we can, we are, we will, and we should do better. And using the frameworks that we have, that are our treasure chest, our skill sets, we can reach utopia, but for that, we need to work. We can't put our arms down. We need to do the best we can with what we have. It's not much, but that's what we have. And of course, we also have our values and each other. So thank you so much. And this is how I finish.